Welcome to the Prospective Doctor Podcast, where we will provide essential information for pre-medical students and those already in medical school. Listen each week for tips on how to improve your application and gain an acceptance to medical school.
Hi everyone, it's Dr. Marinelli here with Dr. Sahil Mehta. Today we're going to talk about scribing and its utility on the AMCAS application. Hi Dr. Mehta, thanks so much for joining me today.
No problem. I'm excited to be here.
I know that we have a lot of people that are interested in scribing or have been scribing as an extracurricular activity before applying to medical school. What are your thoughts on scribing in general as an extracurricular activity?
Yeah, sure. So we have a lot of applicants who obviously are scribes or are looking to be scribes, and it's really become a very popular extracurricular activity for pre-med students and for students who are spending a gap year. Obviously, there's a lot of utility to it. There's a lot of great things that a scribe gets, a lot of great experiences that a scribe gets that they maybe otherwise wouldn't be able to, and they get this while being a paid employee, typically, which is pretty nice because there are not a lot of pre-med opportunities that are paid, honestly, out there. I've seen a lot of people go through scribing, and I've seen just an enormous explosion of it in the last couple of years. And I can honestly say that I think that it's a great experience for a lot of students to get. And we could talk a little bit about why that is and how students should make it something that actually stands out on their application, because that's a question I get a lot. What about you? I mean, have you seen scribes and a lot more scribers recently?
Yeah, I definitely have. I mean, I remember when I was applying, I didn't even think that was an option or something that I knew about. But I have a lot of applicants that reach out to me now to look for clinical activities or things that are going to be meaningful to do while they are in a gap year, as you mentioned. And scribing is kind of something I suggest right away. And I've seen more and more applicants just already coming to me with that experience under their belt. So I definitely agree. It's becoming a little bit more popular, a little bit more common, but it's still a great activity to be a part of. Dr. Mehta, being a physician and working in clinic and in the hospital, have you had scribes follow you around, and what is the utility of being a scribe from the physician standpoint?
Yeah, so I have, and actually from a doctor physician standpoint, it's actually a tremendous opportunity for us to hopefully alleviate some of the burdens of being a physician in modern day practice, which obviously involved a lot of paperwork, a lot of charting, and for doctors that often takes away from their ability to really interact with the patient. Some doctors come in to the room with a computer right away, and the first thing they do is sit down with the computer and start typing because they have to. It's just unfortunately the realities of our modern medical system. A scribe can really alleviate some of those pressures and allow that doctor to go back to actually treating the patient and putting the patient first, knowing that their documentation of the actual medical record is being taken care of by the scribe. And so it's honestly a really awesome thing for most physicians to have a scribe with them, because they really get to, again, refocus their energy and efforts onto the patient and off of the electronic medical record, which otherwise sort of takes over most interactions.
Yeah, absolutely. What do you think is one of the greatest benefits for the scribe?
Yeah, so from a scribe perspective, and as you mentioned, Dr. Marinelli, scribing positions, they didn't even exist when I was applying to medical school. They didn't even exist, honestly, when I started med school coach. We didn't have a lot of students who were doing scribes. This has really been something in the last couple of years that has truly taken off. And I can definitely see a huge benefit from the student perspective, because you all of a sudden are fully immersed into the clinical experience. You're not an observer. You're actually a vital part of the healthcare team. And you're there with the doctor on a day-to-day basis, on a patient-to-patient basis, seeing absolutely everything. And not just seeing it, but actually being involved in it. So there's, I think, a very big difference between, let's say, shadowing a physician, where you're kind of being that fly on the wall and staying in the back and trying to observe and learn as much as you can, versus being a scribe, where you're actually physically participating and have to pay attention, document, understand every part of what is going on, from the history and physical all the way to the assessment and plan. As a scribe, you have to be on your toes and understand everything that the physician is saying to the patient. And it's a great way, obviously, to learn medicine You're not going to be ready to be a doctor, obviously, after being a year of a scribe, but you definitely are going to have a ton of terminology in your sort of bank that you didn't have before, and learn a lot about medicine. And then I think the other real thing that a scribe gets is that day-to-day experience, right? It's an everyday experience. So you see what a physician does day in and day out. You're with them all the time in the clinic. And so it's kind of like shadowing on steroids in a lot of ways, because you're not just there for 2 hours and then you leave. You're really there the whole day and understand what that physician is doing the entire time.
Yeah, I definitely agree. And one thing that I've seen particular value for as well is the patient interaction. A lot of volunteer clinical positions that pre-meds try to get, at their level, they don't have a lot of experience, so they're pretty limited on what they can do with patients. But being able to be in the room with the physician while the physician's talking with the patient, examining the patient, and being, as you said, involved in part of that care, I think is just such a critical experience for a pre-med to get. And you can really get that as a scribe. A lot of scribes that I've seen have also commented on how they kind of get to know recurring patients because they're in the room so often with the physician. And again, they're part of that care. So they'll say, hey, this is Dr. X and this is my scribe, Julie. Oh, good to see you again, Julie, and kind of really take part in the whole patient interaction experience. So I think that is also pretty crucial and also a really great part of being a scribe.
A question that I get, and I'm curious about your take, Dr. Marinelli, is how do I put this on paper, right? How do I make this something that's going to make me stand out when I know that there's maybe 1,000 other scribes out there who are applying to medical school? What can I really do to show that scribing experience was either interesting or something that should make me get into a medical school?
Yeah, so I think you should really use your scribing experience either in your personal statement or the AMCAS activities section to really demonstrate the strengths and abilities that you've learned and gained as a scribe. So don't just tell me, I sat in the room and I wrote down everything the physician and the patient said and I made it into a document. Yeah, that's part of the job, but tell me more about the strengths that you've learned and that you've gained and maybe even mastered. So perhaps you've learned time management skills. Perhaps you improved your medical terminology like you talked about. Perhaps you improved your communication skills or your ability to collaborate with the physician and the rest of the healthcare team. Those are all important skills that you will gain as a scribe that are crucial for being a doctor later on and a medical student that you can really demonstrate to admissions committees on your application from being a scribe.
Yeah, I mean, that's awesome advice. And I think another thing that I would say is for my applicants, I often ask them, what is the patient experience that you've really taken from this? Talk to me about a patient who you saw as a scribe who you really connected with. And it honestly does not have to be about the scribing itself, but about that relationship maybe that you saw the physician form with that patient.
Yeah.
Or maybe there was a patient who you really connected with, or you really had his or her own powerful story, either a story of recovery or maybe even a story of sadness. But you were able to see that and understand how the physician interacted with that patient, understand what you may have brought to the table or what you eventually want to bring to the table as a physician. So I think you can utilize your scribing experience as great experiences simply with patients. And that's how you can really hopefully separate yourself comparatively, let's say, to the person who didn't really interact with the patient and does not have true volunteer and or clinical experience with patients.
Yeah, absolutely. Dr. Mehta, could you briefly talk a little bit about the training required to be a scribe? I know that each training is a little bit different, but what can a pre-med expect if they are trying to become a scribe?
Yeah, so lots of different scribing companies out there, all of which have slightly different training experiences and requirements. I will say that all of them are pretty rigorous and thorough at the end of the day. And so if you're going through the scribing pathway, you can expect to be trained up over the course of a month or weeks in both terminology, appropriate attire, everything that's going to go into making you a good scribe. And a lot of these companies have really done a great job with it. We work closely with a company called ProScribe, who's been able to really give scribes, I think, a great experience at the end of the day. And so rest assured that if you're a pre-med student who's looking for an experience like this, you're going to be able to get trained up before you are ready to dive into the clinical setting.
Yeah, absolutely. Well, great. I think that covers a lot about scribing and what it entails and what to expect as a potential pre-med. If you guys have any questions, definitely shoot us an email, info@medschoolcoach.com. Go ahead and look us up and follow us on Prospective Doctor for more information about scribing and other extracurricular activities.
Awesome. Thanks for having me on, Dr. Marinelli.
Thank you.
Our mission is to inspire, encourage, and inform students as you journey through a rigorous and intricate process of achieving your dreams in medicine. Visit us at prospectivedoctor.com for more essential resources in your medical school journey.